Okay, now we're going to talk about a specific disorder called thromboangiitis obliterans. I am going to let you off the hook where you don't have to learn how to pronounce thromboangiitis obliterans. Aren't you feeling lucky right now? Because the other name for thromboangiitis obliterans is Buerger's disease. It's a lot easier to say, a lot easier to remember. So Buerger's disease is inflammation of the vessel wall associated with clots or fibrosis of the vessel walls. So inside of those vessel walls, you've got clots or fibrosis of some kind, which is like thickening and scarring and things, fibrosis of the vessel walls, ending up with inflammation. It's usually going to affect the smaller vessels of the legs, but occasionally it can be in the arms. The affected arteries are prone to spasms because they constrict quite a bit. There's all that just irritation and inflammation within them. They end up constricting. You end up with inflammatory lesions just all along those vessels, which will eventually occlude the blood flow to that area, and you're going to notice some of these major signs and symptoms that can happen as a result of this. You'll notice the skin and soft tissue becomes necrotic and develops some ulcers within it. And whenever you see necrotic tissue, you'll never forget it because it's black or blue and just very, I hate to use the word crusty, but it's really thick and coarse and dry. It's not good looking, okay? But you're going to notice sometimes some necrotic tissue and ulcerations forming as a result of the constricting and the lack of oxygen and everything from the clots and fibrosing, okay? It can eventually result in gangrene or thrombophlebitis as well, on top of the necrosis in the tissues and everything. It's usually in adult men, but it can be in women, and smoking absolutely aggravates this condition. You need to remember that. The signs and symptoms, their feet are going to feel chronically cold just because of the lack of oxygenation and blood flow to the areas. They'll have numbness, burning, tingling. Whenever we use those terms, we're talking about something called paresthesia. And I go like this every time I talk about paresthesia because it's numbness, tingling in your outermost extremities, okay? Your distalmost extremities. So like the tips of your fingers, tips of your toes, and then it spreads back. Okay, it spreads more proximal as the disease gets worse. So in this picture here, you can see it started with the toes and it's moving its way up the foot. Here's the ulcerations. You can see how it's black there and crusty and dry, dead tissue. It is nasty. Something happens whenever patients have this thromboangiitis obliterans or Buerger's disease, where they can end up with intermittent claudication. Now you can have intermittent claudication with other things, all right, but it's one of the hallmark signs and symptoms of Buerger's disease. What happens with intermittent claudication? Think about the word intermittent. That means not all the time, just during certain times. It's intermittent, okay? The legs are going to cramp or have really severe pain whenever the patient is walking around or exercising or up on their feet, okay? But the pain goes away, or the cramping or whatever, when the patient sits down, relaxes, puts their feet up, okay? So that's the intermittent claudication. Now this is telling us that they are not having good circulation or blood flow to those areas, because when they're up and walking around, you need more blood flow in order to make everything work, right? So bad blood flow, up, walking around, it hurts, it cramps. As soon as they sit down, put those legs up, take a load off, rest a bit, pain goes away, all right? That's intermittent claudication. Now, as the disease progresses, it won't just be intermittent anymore, okay? And that is when they just have severe pain all the time. Even when they sit down, put their feet up, it just hurts. That is when it's very, very serious at this point, okay? And that's when doctors look into more serious treatment methods and everything, okay? The symptoms are going to fluctuate in their severity just based on what's going on with the patient, their risk factors, and how much the disease has progressed also. You'll notice some cyanosis or bluing or reddening of the feet or legs, and like we said, starts in the toes, moves its way up. Mottled purplish red skin with thin, shiny appearance with just very little hair growth, because you need blood flow to have hair grow as well. Black gangrenous areas can develop on their toes and heels, and their nails are going to really thicken also, just because nothing is really working right. To treat it, they've got to stop smoking. They have to, okay? Smoking causes vasoconstriction, and whenever they have vasoconstriction, that decreases the blood flow even more, which is so bad. They need to do Buerger-Allen exercises, and I am not going to make you memorize what Buerger-Allen exercises are. I just want you to be familiar with them and know what they are, so that you know that they are something that you can do as a treatment. And it involves just holding your feet above your heart for 2 minutes, and then below the head for 3 minutes. Move the toes up and down, in and out, return to the first position, and hold for 5 minutes. Whenever you're not exercising, you've got to keep the legs horizontal and independent, which means resting on something, not just kind of flopping out there with no blood supply. Okay? In your book, it's going to really detail how to treat patients with Buerger's disease with Buerger-Allen exercises, and I just encourage you to review that, because it is going to be something helpful for you to know. We're going to give them some pain medications as necessary. A lot of times they need surgery just to relieve the vasospasms. We do wet to dry dressings and topical antiseptics, or antibiotic ointments, or anything that we need to do to help heal up some of those ulcerations that the patients can have. But just, isn't this tragic? See this black necrotic tissue, those thick nails? Oh, it just breaks my heart to even see these people. All right. We're going to do some discussion questions in class. This is just an overview of what they are. You can go ahead and look at these if you want to, but remember to submit your questions on the Blackboard discussion board before class time, so that we can have a good informed discussion. All right, so this concludes this PowerPoint presentation. I'll see you again for the next one.